Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend, Colin Hung. The world of technology and healthcare are ever-changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news, meshed together in new ways which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. Today, we're going to be talking about our health IT predictions for 2024. And be sure to follow the show on social media at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 17 years of health IT blog content at healthcareittoday.com. So I think we nailed all of last year's predictions.
Yeah, we were 100% accurate, right? No, we weren't. But I can't believe we're already at this time. It's just this year has gone and just flown by.
Yeah, well, what's interesting is we used to get like a break during summer, and we used to have some other breaks. I think we will get one hopefully in the holidays this year. But this year it didn't happen. I think the schedule of conferences got thrown off. It's been an interesting year, and there's a bit of tepidness in the environment. Uncertainty, I think, is where we're at.
Yeah, I could totally agree. This year was one of the years where there just wasn't a break. Everything was just happening back to back to back. But maybe before we start, just a quick review of what we predicted last year. Do you remember any of your predictions from last year, John? I
mean, I'm pretty sure we were going to predict, I think I predicted AI because we only excluded workforce,
right,
and some of those things, but we didn't exclude AI, which is really fascinating because this year we're excluding AI.
Yeah, because that was the only thing people wanted to talk about this year.
Yeah, so I think that was my big one, and I think it's come to fruition, right? AI has just exploded, and well beyond. I mean, so my prediction was probably AI, but it's went so much further than even I had predicted.
I think I remember predicting that we were going to see a lot of mergers and acquisitions, and we certainly saw our share of mergers and acquisitions, but none on the scale that I had thought. Because of course, last year we were talking about Oracle and Cerner, and I thought, oh, that's going to spell a wave of this type of mega-sized acquisitions. I mean, it really didn't happen this year. There were some smaller ones, but nothing on that scale.
Yeah, and I would say the ones that did happen were like the next-gen acquisition by Thoma Bravo, which is more private equity acquisition, right, as opposed to like two massive EHR vendors being acquired or merging together or something like that. But yeah, we didn't really see that kind of merger of two companies as more private equity.
So let's get to the predictions. In 2024, John, what is going to be the biggest topic next year?
All right, so we said we're going to exclude workforce
and exclude AI.
Everyone's burnout.
Yeah, that's right.
We all predict that more burnout with AI.
Exactly.
Hopefully helping that burnout. When I look at it and I think, okay, what topics are kind of coming to the forefront? I debated maybe some consumerism type stuff because so many retail organizations are going in there. Interoperability has done some interesting things and has made some progress. QHINs are going to come into full force. But I actually think the biggest topic of 2024 is going to be around regulation. I think the regulations have come and they're finally putting some teeth into them. Whether it's information blocking, which now has disincentives, as we covered in a previous episode, right? Or whether it's CMS applying different reimbursement mechanisms. I heard about one today, where SDOH has to be included in your intake at an acute care facility. And how are they going to get them to do that? Well, you get a penalty if you don't. And so I think that's an interesting one. So I'm looking at regulation to be the hottest topic of 2024.
Yeah, I don't disagree with you. I think the big topic we're going to be talking about in 2024 is definitely the HIPAA regulations, the new guidance that's come up from the ONC, and all the lawsuits that are now flying back and forth. I think that is going to have ripple effects, not just for right now the marketing teams, but all the teams. Anybody really engaged in patient engagement, anybody that's dealing with patients through an electronic means. I just think there's a lot of realization now where there's a lot of things happening behind the scenes that maybe people weren't aware of that now we need to be. So I think the HIPAA guidance, I also agree with you in terms of the disincentives, for information blocking. I think, 2024 is going to be the year of regulation and policy.
Yeah, and we'll see what happens with AI regulation. Someone posted, I think it was on Twitter, I saw a tweet that said something like, so wait, we're going to regulate a technology? When has that ever happened? Did we regulate sequel or because that's how you're like, we didn't do that. That doesn't make sense. So, and there's a fair point to be made. Do we want government regulating something where they can't keep up? And it's just going to have damaging effects. So, but I think that there's so much momentum around it that they are going to do something. We'll see how far-reaching it is.
Yeah, the other topic I think that we will be talking about, not because we're going to make a lot of progress, but I think there's going to be a lot of noise, is around patient engagement and patient experience. And the reason why I say that is because we're going to continue to see more entrants from retail health, more expansion. We just had the announcement of what's happening with Prime members, right, and access to care now through Prime so easily. I think that's just going to put so much more pressure on healthcare organizations, traditional ones, to do more around patient engagement and patient experience. So I think that's going to be a topic in 2024, but it's more of a reluctant topic. They're going to be forced into it because of things happening in the other spaces.
Yeah, I saw the Amazon announcement as a nothing announcement.
Okay.
Well, although it's interesting, you look at Amazon's revenue streams, it's actually the cloud, and then it's advertising, and then it's products, right? And you look at that and you're like, okay, so they have this big advertising engine. And so could they use their advertising engine to promote healthcare services? Yeah, so it's going to be successful because they have this massive advertising engine, otherwise known as Amazon.com at the base, let alone that they emailed me about it, right? So, I think it could be successful, but I don't think it's going to dent anything in healthcare. So to me, I don't know. I'm a little skeptical on how that's going to impact it. But you're right. I don't think that experience for a patient is going to change that dramatically. But it will be interesting to see, will value-based care finally kick in? I think we're still 2 to 3 years out for that. But if value-based care kicked in quicker, then maybe we'd have more of a conversation.
So next question, John. Will patient expectations and patient needs be improved in 2024? Are we going to make any significant strides at all next year?
I mean, I think we'll see pockets of it, right? So I think we'll see pockets of innovation. And that's been the problem with healthcare when it comes to patient engagement, is that it's not evenly distributed. There's some health systems that are doing incredible work to make it an incredible experience for their patients. And there's some that don't need to. If you're in an area where there's not a lot of competition, you got a 4-month wait list, you don't have to. So I think that's going to be problematic to actually improving the patient experience. But I think we'll see some pockets. And I think we actually may see a turning point for things like online self-scheduling, for patient reminders, for access to patient data. I think some of that may turn a corner in 2024. So, information blocking is helping some of that as well, right? So this pushing forward kind of this open notes principle that we had, so I think some of that we'll see. But when it comes to the actual navigating the care of it, I don't see many improvements.
I'm completely opposite. I think we're actually going to make some good strides in patient experience. But like you said, maybe in certain pockets. I think, for example, that with all the work being put into using AI and large language models, I think we're going to see an improvement in the quality of communications with patients. Because I think it's so easy now to just, hey, instead of the standard mechanical reminder that you get or the instructions, throw that through a large language model, improve that, translate it into the language of the patient, and then send it. I think we're going to see an improvement in the quality of communications. And I think we've already seen some studies that show the AI-generated letters coming from supposedly the physician sound way better than the actual ones from physicians. So I think that trend will continue. I also think that we're finally going to make some strides in more evenly distributed self-scheduling. Because right now it's lumpy. I think it's very easy to schedule things like a family doctor visit or a checkup or things like that. But as you get into more complex care, it's still phone the call center. So I think we're going to see more and more people move as they clean up their own processes and make sure they have the provider directories and stuff. And the one area I think also that we're going to see some improvement is actually around remote patient monitoring and care. I think we're going to finally crack the nut in 2024 around, okay, like what is this really going to be useful for? When are we going to have and use that data? And we're going to finally have, this is actually a pretty smooth experience of you taking home these devices and using them at the house. I think that's going to happen in 2024.
Interesting. That would be a better patient experience if they could crack that nut, right? You bring up an interesting question, though. Will large language models and AI associated with it, like will Dr. ChatGPT, right, like, or the other ways it's being implemented, this generative AI, is that really going to improve the patient experience? You gave some examples, right? Like the letters are better. That's interesting, And I look at it from a patient perspective. They are going to ask ChatGPT, not Dr. Google. I saw someone recently comment like how different the experience is asking Alexa or Google, right? Like, tell me this answer versus ChatGPT. I think it was actually Mr. H from his talks that said that. And you look at that and you're like, that is true, right? And why aren't those incorporated into it? Because it would change that whole experience. But you look at that. Will that change it? I've seen it even where people take their medical record, throw it into ChatGPT, not HIPAA compliant, by the way, but for some people, they don't care. Or maybe it's just the patient information they received, the education sheet they received from their doctor. They throw that in ChatGPT and say, what does this mean? Give me a summary.
Right.
And like that creates a better patient experience as well. So, I mean, I can see some arguments there. And obviously, if ambient clinical voice is successful and the doctor can focus on the patient, that'll improve the patient experience better. But I don't know. What do you think as far as AI and LLMs?
I think so. I think we're still far away from AI being the science fiction version where you're interacting with it and it's giving you a diagnosis and all that kind of stuff. I think we're kind of nipping at the edges. Where I see real application for AI and where I see the improvement is actually in translation. Not a lot of organizations can afford real-time translation. It's expensive to get documents translated. But now with AI tools, you can very, very easily translate something into another language. It's no longer an excuse, right? It's so cheap. So now, instead of waiting for that letter or that education to be translated, you can do it yourself, essentially. And I think that just improves experience for people who are non-English speakers. So I think that's going to make a big difference because we've seen it. We both saw it at the Clinical Works user conferences that we've been to, and how they're incorporating AI into what they're doing. We've seen it obviously with folks like from Epic that are doing similar things. I've seen it as well. People like Kairos and others are just using these kinds of technologies to make that meeting the patients where they are better in terms of at least the language. So I don't think it's going to be like where you're going to be interacting with the doctor through a ChatGPT-like interface, but I do think that throwing the documents and throwing that kind of stuff through ChatGPT just going to be much better, much nicer, more empathetic communication from your provider.
Yeah, I saw the demo from Lexmark where they scanned in the document that was an English language document, and it spit out a printed version of the Spanish version of that document, like put over. It lost a little bit of formatting, but who cares, right? Like
Right.
if the words are right, then you accomplish what you need to. So that was an interesting, similar example of using the AI, the translation, et cetera, to be able to solve some of those problems, which is great because the beauty of AI is in many cases it scales to 100 languages, like hundreds of languages. So, even your call service, right, that does the language translation, often that can't do that. So, yeah, that's an interesting example.
Hey, if you're just tuning in, you're listening to Healthcare IT Today with my partner, John Lin, and Colin Hung. We're doing our 2024 predictions for health IT, and we're trying to make sure we aren't as bad as last year. So hopefully we're more on the mark. Today's episode is brought to you by Sway Health Live. The conference is happening May 6th to 9th in Atlanta, Georgia, at the W Hotel in downtown Atlanta. Wonderful place. We're looking forward to gathering all the healthcare marketers, whether you're at a provider organization or whether you work in health IT. Come on down to our conference. You can find out more information at sway.health. That's sway with 2 A's, .health/events. So, what else is next on tap for us in 2024, John?
Yeah, so, as I look at it, like, let's look at what companies we think are going to surprise us with something cool and innovative in 2024. I mean, when I look at that, I'm like, there's a lot of options, right? And I actually think that probably the most innovative things are going to be like a combination of companies.
Sure.
Like I don't know what Verado and Clear are going to do with identity. That's fascinating to think about, right? And identity management is such a problem in healthcare. But I'm actually looking at those that drive patient behavior.
Mm.
I'm thinking about Upfront Healthcare, who I met with recently, and some of the work they're doing to drive it, or even Lumion with their patient flows, right? And ensuring the patient's flowing to the right place at the right time. Like companies like that, I think are positioned well to really make an impact on the patient and ensure that they're getting the care that they need and changing that experience. So I'll be interested to see what they do. And when you look at what they're doing and what's possible with AI, it's making all of that more possible and easier to implement. And so, I think those types of companies are going to be really interesting.
I'm going to go with the safe bet because I want to bat 1,000 next year. I think the company that we're going to see the most of, and it's going to be surprising, but in a sort of expected way, if you will. I mean, it's sort of a contradiction in terms, but I think is Microsoft Nuance. I think just next year we're going to finally hear all these wonderful stories and innovations happening with their DAX system, with ambient clinical voice. I mean, every conference I go to, I'm running into more and more people who are using it in real situations and beyond the pilots now. And everyone is just like, wow, I can't believe what it's being able to do. And now I'm starting to train it so that it can behave the way I want it to in terms of mixing discrete fields of information along with just the regular notes. So I'm predicting that we're going to hear a lot more from our friends at Microsoft and Nuance in 2024.
It's interesting. I thought you were doing the safe prediction, so you were going to go with Epic.
That's true too.
Which interestingly enough, I was talking to someone and they were giving me a little behind the scenes of what's happening at Epic. And I think I heard someone say, of course I didn't verify this, so take it with a grain of salt, but they said that Epic has 100 different generative AI projects happening right now.
I don't doubt it.
And no doubt they should, right? Like if I were in their shoes, I'd have 300, right? Like I'd have as many as you could think up, right? And it's their MO, right? To not announce it until it's, working properly. And so I think that's interesting to see, that, hey, they're investing in this in a big way. They have the money, they have the resources to do that. Can they execute that? They have the user base if they can execute it. So, maybe that is actually a safe bet.
I think also we're going to hear a lot more from companies that are entering in from the marketing side. This is more of a Sway Health kind of a prediction, but I think we're going to finally see some movement in healthcare-based CRMs. And I think the reason for that is because of the personalization side of communication that I think is going to be needed now. So in order to do that, I need more information about the patients themselves that go beyond their clinical stuff that's in the EHR. And there isn't a natural place to hold that. Now, funny enough, Epic is working on something through their Cheers product that offers this. I think Salesforce may come back into this world and kind of go, hey, like you want a patient CRM, this is where we can really make a go of it. And I think there are other ones that are more specific. We know Loyal has sort of some things that are baked into this kind of space. And I think that's going to be an area where I'm going to be pleasantly surprised, as we hear more and more people adopting those types of solutions and the innovation happening in that particular area.
Interesting. I'll throw another one out there, and I would say this is more in like the hospital room.
Okay.
And I think it could be a mixture of different vendors. I mean, I just saw, I think it's called Artisite, if I remember the name right, with Stephanie Lahr, who used to be at Monument Health as CIO. She's now over there as president. And, a company like that that's combining computer vision with sensors, with a camera in every room. She predicted that on our CIO podcast. So, in our interview with her, she said that there's going to be a camera in every exam room. And you think about, okay, what does that enable? Because it is the computer vision to know, is there fall risk, is there movement? Now even we see with I think it's Neurologics, right, that uses that camera to know their heart rate and other biometric signals. When you look at that and the innovation that's happening there, making the bed smart, with sensors, computer vision, camera, which can also do virtual nursing, virtual rounding, telehealth types of things. I think the way that someone's going to package all that together is going to be really beautiful, and it's going to be important. And I think that's the reason they're going to probably have a breakout, is because of all the staff shortages. They need these solutions so that the nurses and doctors can be more efficient.
One thing I wish, John, is I'm hoping that we finally see some news around wearables again. And now that the sensors have gotten better, and hopefully we've gone past now the hype phase and into something that's more interesting. I'm hoping, not predicting, but hoping for some better news on that front as we get more into remote patient monitoring, as more people start to accept this kind of data. Anyway, I'm hoping for that in 2024.
Yeah, I'm about to get a circular ring. We'll see. You know, they have they're sending this. We'll be demoing out and seeing, and it is interesting. They're getting more medically relevant. So hopefully that fits your need.
So this is where I struck out last year completely. To keep going on with this baseball analogy, what do you think is going to happen on the mergers and acquisitions front? Are there any major ones that you're going to predict, or are there maybe an area that you think there's going to be a lot of activity in 2024?
Yeah, so I think one area that I'm looking at is what's going to happen with the EHR vendors and ambient clinical voice vendors. Are they going to chomp them up? And because in many ways, the ambient clinical voice, if it's successful, becomes the interface for the doctor.
Right.
And if that's the case, if I'm an EHR vendor, I want to have that interface. Right now, I am the interface, right? And so do I want to give that up, or should I just go acquire someone? There's some obviously complexities, right? Because if you chomp someone up, and they're, doing it for your competitor, how does that play out? Does that ruin that business? But maybe you want to do that to damage your competitor. So I don't know exactly how that's going to play out, but I'm really interested to see if someone does go and acquire one of these ambient voice vendors that's an EHR vendor that has a bunch of cash.
That's interesting. I'm totally with you on that. I think that it's a natural progression of where people and how people are integrating these ambient clinical voice systems into their EHR. I think also there are some people that are inventing their own or basing it on some of the products from other people. So I think they're OEMing some folks already, but it'll be interesting. I think definitely we're going to see some movement in that space. For me, I think I'm looking at mergers and acquisition more in a space around the whole self-scheduling bit. I just think there's so many components here, from patient identity to provider directories to the actual interface that's on the website, to all of the spidering that has to go on into all the different source systems to figure out what appointments are available. Right now, all of these things don't happen together. There's a couple of companies that are trying to do this, but there's a lot of different systems. Where I have my provider directory is not where I'm going to serve it up in terms of on the website. So I'm predicting that companies are going to finally, buy each other or merge together to create a more comprehensive self-scheduling solution for the market.
Interesting. Well, and it's interesting, like ZocDoc came out with their free one, right? And heard that fray, and we'll see how that all evolves. But, another area that I'm looking at is the analytics side. With all this data's gold, but the more data, the better, right? And so I'm interested to see, what does Health Catalyst do, right? What does, even Komodo Health, who has all this data, will the IQVIAs and that come to play in this space as well? All these data analytic vendors, we even have all these initiatives where providers are coming together with their data to offer something. Will those roll off on their own? Will they sell it to someone else? I don't know exactly who's going to buy who, but it feels like there's enough data challenges there and people who've aggregated it and worked on certain problems. They should roll it up into one solution and be able to provide all of those data solutions to a vendor, or just have extra data to be able to solve the problem better.
One of the areas that I'm wondering if we're going to see some acquisitions is, did HIMSS kick off a trend? Are we going to actually see more associations, more organizations who have a conference sell that to somebody to run it for them and manage that? Because let's be honest, I think the days of the conference being a large revenue generator for these associations are gone. It's just so hard, especially in the current economic environment, to generate a lot of profit from running an event. I think it serves a different purpose. I mean, it's still educational, still all that stuff, but the actual running of the event, is that something that an association should really be doing? I wonder if what HIMSS did, we were going to see more of that in 2024, where organizations just kind of go, you know what, we still have to have one, but let us run the education and we'll let somebody else deal with all of the vendors and the exhibit hall and the sponsorships and all of that kind of stuff.
That's interesting. I mean, Informa is hungry, so
we know that, right?
They like to acquire, and it makes sense. That's their business model and their approach. It is interesting to think about the associations and kind of their influence because we've seen the growth of the user conference. I think maybe it's because we've become so dependent on the EHR and the other IT systems that we use. Even in the marketing space, a lot of these marketing user conferences and stuff are pretty effective, and they're great because when you go to them, it's all your peers.
Right.
Like the signal is really high. Whereas when you go to a generic health IT conference, like, you might run into payers and you might run into pharma, and you're like, it's kind of interesting, it's good, and it gets me out there. Occasionally it's a fun conversation, but usually you want to find your peers. And at user conferences, the signal is so high because there's so many of your peers there.
That's right. Yeah, I mean, you hit the nail on the head there. I don't think we're going to see anything on that side of the fence for sure on the user conferences, but I think the larger conferences, I think that's why they're suffering a little bit. I think people are reevaluating the value of them. So John, any last M&A predictions you have?
One area that we've seen happening for a while is the RCM. The revenue cycle ones are doing it. So that's actually, going back to the last question, two big companies that could come together as two big RCM vendors.
Yeah.
Like there's some interesting antitrust questions there, because they're almost to that size where that becomes a question. But you can see, if I'm a hospital or health system, I only want one RCM vendor to do all my accounts receivable, my low balances, my,
Yep.
and then have the AI solutions to do a lot of the things. You're going to need a certain scale to be able to do that effectively, probably, and they'll just chomp up all the promising AI solutions and package it, or they'll buy each other, to really create that center of mass, if you will, around it. So we've been seeing that happen for a while now, but I could see a couple of the really big guys just coming together and being like, hey, let's combine.
Yeah, I mean, it can't be only 3M in the space, right? Like, it's got to be other people in the RCM space. And I'm also wondering whether or not the banks are still going to sit on the sidelines. For years, I think people have predicted, like, why aren't they getting into the space? Why aren't they owning some of these RCM companies? Maybe we'll see some of that movement in 2024.
Yeah, is that a conflict for them? I don't know. They are in the space as far as wanting to be involved, and they've acquired some things because of the debts and different things that they own for the different organizations. But yeah, that would be interesting to see.
Well, you just think about the patient experience alone. It would be so much smoother if I know the bank that I'm with is actually doing the billing as well. I mean,
would they be able to bridge that gap?
Who knows? But we'll see. Hey, but thanks to all of you who tuned into this episode of Healthcare IT Today. To find out more information about our program, go check out the programs page on healthcarenowradio.com. And please engage with us and the community at healthcareittoday.com and on social media using the hashtag HITSM. I'm Colin Hung, along with my Health IT collaborator, John Lin. Thanks for listening, and we'll catch you on the next episode.